Good morning, everybody, and thank you for joining us for today's session. Today, we'll be discussing about how to get into Boston University and learning a lot more about the process and the journey from Dr. Shivangi. I'm Asta Vas and the founder of Dental Student Society. Intention of Inside Dentistry here is to help out one another in this journey, and hopefully all of us, get the American dream that we want. Dr. Shivangi, you can take over.
Okay, good morning, everyone. I'm Dr. Shivangi Shekhar. Presently, I'm doing DMD at Boston University. Firstly, I would like to thank Dental Student Society for creating such a wonderful community, a platform, and bringing dentists together from all over the world. Incredible job, Dr. Astor, and congratulations on that. Coming to
Thank you
me,
so much.
yeah. Coming to me, I'll just glimpse of my journey. I'm from Jamshedpur, India. I did my Bachelor of Dental Surgery from Manipal College of Dental Sciences, Bangalore, and then went ahead to do Master of Dental Surgery in Conservative Dentistry and Endodontics from the same institute. I graduated in the year June 2022, and then came to US in September 2022. So soon after coming to the US, I started looking for answers. And then I started shadowing at a dental clinic near me. And I started to integrate into the US healthcare system slowly, understanding the process and everything. So it took me a while, like 2-3 months. Then I started preparing for my INBD in January 2023. So I gave my INBD in April and my TOEFL exam in May. And the results came around mid-May or something. And I was already late into the 2023 cycle. So I started working on my application, like CV, the SOP. Written part of your application is very, very important. We'll emphasize on this a little later. And then I applied in July. In like 2 weeks, I received an interview invite. My interview and acceptance was both in August. Like I gave my interview on, I think, 3rd August, and acceptance was on 18th of August. So I received my acceptance from there. This is a lot of people have DM'd me and messaged me about my profile. So this is just a summary of what I have done. So I did MDS and then I gave INBD. I gave TOEFL and I had only one chance to give TOEFL because I was late into the cycle. So the TOEFL, I scored 95 and applied with what I had. So I would just emphasize on TOEFL is that TOEFL is not an easy exam. It's an exam that requires practice. So I made this mistake. So please, no, I don't want anybody else to make this mistake. Like practice for TOEFL, and we are very confident, go for the TOEFL exam. And I did dental assisting and shadowing. Like I did dental shadowing because I was on H4 visa. So I could not work. So when I applied, I had completed 8 months of dental shadowing. The schools in the US emphasize a lot on community service. So if you are in the US, or even if you're in India, try to, wherever you are, like try to gain some experience with community service. Like I did not have time in the US, but I had worked for an NGO, Make a Difference, for 2 years in India. And then during my master's, I took up 3 research projects and went ahead to publish them. So I had 3 publications when I applied for the CAPIT cycle. Coming to CAPIT and PASS application, since I was late into the cycle, I applied to only 6 dental schools, and I not apply because I got accepted, so I just left it. I was accepted at 1, waitlisted at 1, and invited for 2 schools. I also applied to endodontic residency through Idea Pass. So, and I was interviewed and waitlisted at 2 schools. So that is, then I realized that I'll go ahead with DMD advanced standing because with endodontic programs and direct residency, a lot of limited licensure is there with it. So I thought I'll just go with the DMD or DDS programs. What I feel that you can add to your profile, like everybody will have INBD, everybody will have TOEFL, that numbers, everybody will have a GPA above 3. So what makes your profile unique, little different from others? What you can do is community service. Like I cannot emphasize enough how much they like the schools in the US give importance to community service. So wherever you are, try to do community work. Then dental shadowing or assisting, like mostly it will be shadowing because a lot of people come on tourist visas and visas which not allow you to work. But so you have gained some kind of experience by doing dental shadowing at different dental clinics. Then research experience is not a requirement by any program, but if you have it, it does add, like give you an edge, it does add to your profile. Then publications and CE courses. So when you do CE courses, it gives an impression that you are interested in upgrading yourself and keeping yourself updated with the recent advances in the field of dentistry. So like Boston asked us only to list CE courses which we have done in the past 1 year. So so I feel that CE courses does hold a lot of value when you add it to your profile. Coming to the Boston interview, it was a very casual interview, like a very casual sort of a conversation. It's mostly on your SOP and CV. So please stay connected to your SOP and CV and make sure you know everything on your profile. Like there are applicants who have things on their profile they don't know about. So make sure that whatever you're putting it on your application, you know about it because they will ask you questions related to it. See, and be honest in your interview. If you even had failures or if you could not make it in the previous attempt, so just be honest with them. And they'll definitely ask you why BU. So make sure that you have gone through the website, you have gone through the requirements of the program and everything when you're applying for BU. Coming to the DMD Advanced Standing Program at BU, the class size is 100. We come from 26 different countries. They focus a lot on diversity and inclusivity, and the application is through CAPIT application, and they also have a supplemental fees. And they don't have supplemental questions as such, but they do have some questions which is present in the program materials in CAPIT. So make sure that you do those questions very carefully. The interview is conducted through Zoom. It's an online interview. Acceptances are sent out in batches. Like they can send out acceptances whenever they want. Like I have batchmates who were accepted 1 month before the program started, and also there's also someone who was accepted 1 day before the program started. So you never know. So, and we are integrated with D3 and D4. So we are called AS1 and AS2 because the program is of 2 years. AS1, like we are mostly in consist of lectures and simulation lab, and AS2 are in the clinics and they also have some lectures. What everyday schedule at BU looks like, it generally starts with a lecture. It starts at 8 a.m. mostly. It starts with a lecture, which is followed by practical in the simulation labs. And Boston University's simulation lab is the most advanced simulation lab in the entire North America. Like, and they have a capacity to hold all 100 of us in at one time. Like there's no rotations, there are no groups coming in. We all 100 go at one time, and we are all learning at the same pace from the same faculty in the same manner. So that what makes Boston a little unique from other schools. Every station in the simulation lab, they have a computer, and you have to log in with your BU ID and password, and you have the live screening. So whatever the professor is teaching on the podium, you have it live screening on your on your computer. So you simultaneously learn with the professor. And if you get stuck, like if you're not able to understand and if you get stuck somewhere, you can call other faculty members and they'll definitely help you. Simulation lab like is open from 8 a.m. to 11 p.m. The faculty members are only present during the college hours, but sometimes you'll get an email that this particular faculty is present at this particular time. So if you want to go and practice that particular subject, you can go ahead and do it in the simulation lab. Faculty will be present. And the faculty evaluation is done after each exercise. That is what I really liked about is that every step of whatever we do is graded, is evaluated, and our mistakes are like they tell us our mistakes at that particular time itself, so we can correct it in the future. So that is what I like. And one more thing is that whatever they teach in the lecture in the morning, the same practical work we do it in the simulation lab. It is followed by it. So the understanding, I feel that people understand it in a better way, the theory part of it, because we are applying it in practical, we apply it in a practical way just that day. So I feel that like what do you like this way, I think people understand better in a better way. So morning we do have lectures, and on the right you can see there's a live streaming of whatever they are teaching us on the podium. So this is from the TMD and occlusion simulation lab class. Coming to extracurricular, uh, we have American Dental Association. They have study clubs, like you can join endo study clubs, pedo study clubs, orofacial pain, name it, BU has it. So you can join different study clubs. There are special lecture series, there is lunch and learn. So you will get an email that this particular professor is teaching this particular topic in a particular venue. And if you are interested and you are free, you can definitely go and attend that lecture. It's like an extra knowledge which you gain through this. So lunch and learn, you during lunch and learn, you are served with lunch, generally pizzas and wraps and burgers. So it's a wonderful experience altogether. Then there is ASDA events, like American Student Dental Association events, which happen in the evening. Sometimes the events are collaborated with other schools, so you meet the faculty members and students from other schools, which help you which help you with networking. Like ASDA is holding a national leadership conference in Chicago this year. So every school is sending its representative. So BU will also send its representative, where you can meet new people, develop leadership qualities, and you can represent your school. So you have a lot of opportunities like this. So if you are interested, you can definitely go ahead with all of this. And these are the pictures from the ASDA events on the left, and right is from a lunch and learn which recently happened. Then community service. BU emphasizes a lot on community work. Like they do a lot of community work, and they expect you to also be involved in community service when you are at school. So you are assigned community work on on a particular day or something, and then all of you go and go for that work from the school. So this is recently we went to a organization where we were packing food, cutting vegetables, packing food for people who are immunity compromised. They have certain food, special foods for them. So we were packing those. So the picture is from there. Then coming to library, library as a resource. The medical campus library is a two-story library, it's a huge library where you have all the resources. Like if you want any articles, you have. If you want any books, there's a particular way, like you can email them that I need this particular article and I want to read through this, so they'll send it to you. And you also, in the library, you have individual study sections like this, and they also have rooms like groups for group studies, or there are certain pods like which you can book in advance and go and study there with your friends, or even if you want to go alone, you can book a individual study pod and it will be booked for you, and you can go and study there. So all these facilities are there. And there's a video I made. It's like this. You can see an individual study pod on your left, and this is the individual study section. Then coming to fitness and recreation, BU has a huge fitness and recreation facility where you have all the sports from basketball to swimming to squash, table tennis, everything. They have a gym there, which is 3 to 4 story, I think 3-story gym. And you also have you have like things like mountain wall climbing, and all of these things are also there. And as a graduate student, you have free access to all these facilities. So, and this is present in the main campus. So there's a shuttle which takes you from the medical campus to the main campus, and you can access these facilities. Staying safe on campus, we have public safety and BU police force. They make sure that you're safe on the campus. There are particular numbers where if you don't feel safe or anything, you can just text them or call them. They'll be with you within minutes. And I have not had any experience till now about this, but I have seen BU police and public safety on the campus, and they're extremely friendly, and they're there to help you. So the campus is very safe. The other facilities provided by BU are BU housing, BU shuttle. There's a shuttle service from the main campus to the medical campus and medical campus to the main campus. I think it's every 15-20 minutes. That shuttle is free. And during beginning of your DMD program, you're giving all the instruments like A to Z, everything is given. And I'm extremely happy with whatever they have given, because they are of exceptionally high quality instruments that they have provided. And everything is provided by the school. Like if you miss something, if you've broken an instrument, there is a store in the basement where you can go and get things exchanged, or you can return that and get a new instrument. Even with hand pieces, it's very easy. Like you can go there and tell them that the handpiece is not working, so they'll repair it and give it to you. So everything is under warranty for the 2 years, and everything is provided by the school. Even if like in simulation lab a particular thing is not working, you can just put in a request for the dental repair, and the repair team comes immediately to solve the problem. So everything is very, very smooth in BU. That's what I feel. And I also feel that the faculty at BU is extremely helpful. It's a very student friendly institute. It's a very student friendly environment where they do go an extra mile to help you. Like if you're getting stuck or if you have problem, they do go an extra mile to listen to you, to solve your problems. And 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 even like they have student affairs, they have certain organizations, like certain departments. Like even if you have personal problems, you can email them, they'll reply immediately, set an appointment with you, you can go and meet them. So I feel that it is a very student friendly institute. Even with professors, like if you want to book a meeting with them, you can just email them, they will reply back to you, set a meeting with you, and they do try to help you in every possible way. So, and this is the this is the last slide. You can reach, like, this is what I cannot put more pictures because of the confidentiality, but I feel that BU, like I'm very grateful that I chose BU or BU chose me, because I am extremely satisfied with my journey. Like from July, like it's been only 2 months, but I'm extremely happy and satisfied with the whatever they have been providing and whatever they have at BU. So it's been a it's been a wonderful experience at BU. And this is my Instagram and email. If you want to reach me on this, you can, if you want to contact me, you can reach me out on this. And thank you for your time today morning. And we are open to question and answers. If anybody has any question, I'm ready to answer.
Thank you so much, Dr. Shivangi. It was a very descriptive and a beautiful presentation. Definitely, I think a lot of us got to know much more about Boston University, not from just the outside, but even the inside stuff.